This program contains content that may not be suitable for viewers under the age of 18. Viewer discretion is advised.
Ruzungu kade kazuku tujikole sawa namba ruzungu.
Ruzungu tugenda muza kujere kutoka ntoko ndimbuzi ndi hapo ala babaddi abachala
wale somoyo manyembuto katonda ya chembuto genda weji waminge
yabawereza buno bukeke obutini
singa babu mutwale bamusonseka mukamwa bwonna n'abufulumiza mu nnyindo
kibwa ina guno omugogwa musa waitista premium detergent
waliwo wanagambye munda yakasajja kasendi kalimba banaye esendi banaye.
Welcome to yet another edition of Kasuku Live. Talk to the doctor, live from TMR. Every time we come to talk about different topics here. And today I'm joined by the
gastroenterology surgeon.
A
surgeon for the intestines. Yes.
No, go over gastroenterology.
Enterology.
Kakambwe.
You're welcome to this conversation.
Yes.
I'm Ronald Chiwewa. I'm a general surgeon, but now significantly heading my practice into gastroenterology surgery or surgery of the intestines. And we are here to have a candid discussion on contribution of this field of practice to patient care. And I'm super glad to be a part of this, to have this discussion.
Okay.
Yes.
So what does a gastroenterology surgeon do?
So these are surgeons who are preoccupied with solving problems related to people's digestive system.
Okay.
So significantly, this digestive system, that runs from the teeth to the anal area.
Yes.
And they are charged with both the diagnosis, finding out, as well as the treatment, the surgical, medical sometimes, but significantly the surgical management of diseases of the intestinal system. Yes.
Wow.
Yes.
Digestive system. So digestive system etandikira one.
From the teeth, and it runs like a
tube.
Yes.
Nejja wano tulinawo esophagus.
Negenda mu esophagus.
Neitamu nejja wano.
Yes.
Wano tulina small intestines. Ne large intestines munda.
Yes.
Ne liver eri part of the digestive system.
It is.
Liver, kidney.
It is an accessory organ of the digestive system, the liver. The liver always makes a very important juice called bile. It's a green juice. That juice travels in special tubes or systems that deliver it to the intestine to help with breakdown of food.
Okay.
It mixes with the food to help with breakdown of food, and there can be things that can go wrong with that system that complicate the whole digestive system. The kidneys are part of another system that makes urine and filters blood to make urine. So
they are not in the digestive system?
Not predominantly in the digestive system. Yes.
Then it goes through There is a part of the digestive system that interested me nga tukyakisomako.
Yes.
Naye abantu abasinga tebagifaako.
Yes.
Ye bagita apex. Kano akasembayo wano.
The appendix.
Appendix.
Yeah, the appendix is a small organ. It is to the right side of your lower body. And in many young men, especially many young men, once blocked, it can be a source of trouble. Because once blocked, it gets sick, and somebody shows up with severe pain, and will end up many times getting a surgery to remove it. But it's a small organ attached to the start of the large intestine that can get blocked, start to fall sick, and get you into the operating room to be removed so that you can be well again.
Okay.
So the digestive system, like you have highlighted, from the teeth to the esophagus to the stomach to the small intestine, which also has 3 parts, a duodenum, a jejunum, an ileum. Those are the terms. And then to the large intestine, which also has 7 parts. The large intestine is
7 parts.
the collecting system, which is the cecum. Then you move to the ascending colon, it moves up. Then the one that comes across transverse, then the one that goes down descending, then the one that folds the sigmoid, then the rectum, and then the anal area where the stool passes. So it's a long system.
The rectum and the anus are 2 different things.
Correct. So the rectum gathers the stool, and then the anal area discharges the stool to the outside. That's
the difference.
Yes, yes,
I get it.
Yes.
What are some of the common, because why I'm asking for some of the common diseases now, we have lifestyle issues.
Yeah.
As a doctor, what are some of the common diseases you're now treating people on around that system?
So many times our role comes in a diagnosis. So many people are showing up with the pain in the chest, in the center of the chest.
Here.
Yes. Pain in the upper abdomen.
Here.
Sometimes chronic cough. Pain in the lower abdomen. Constipation. Vomiting blood. Passing stools that have blood in them. Altered habits of the bowel movement. Today, constipation. Tomorrow, diarrhea. Abdominal pain. Distension of the abdomen swelling, and that kind of thing. And every time they show up with those complaints, you could discover that they've been to so many facilities and had multiple drugs given, and they have not got relief. That's why it's really important to have a proper diagnosis. The gold standard would be for you to have an investigation that puts a camera. It's like having a second eye inside the intestine. So that you can get to tell what could be wrong with this intestine.
Abantu abasinga bakitya ekyo.
Bakitya naye nga tebandi kyeraliikiridde. Kuba ennaku zino twakirongosaamu nti bakusirisaamu. N'otabonaabona nakyo. Abantu abasinga batya okumira kamera eyo bwe babeera bakebera ng'eno waggulu mu endoscopy. Ne bawulira bubi. Ne beeraliikirira. Ebiseera bino standard practice eri nti tukuwayo akadagala ne kakusirisaamu n'oba nga totegeera bigenda mu maaso, ne tusobola okuteekayo kamera eno nekkirira ne turekodinga mu vidiyo ne tukuba n'ebifaananyi bingi. Kubanga tumanyi ekiri nnomo, tusobola okulaba what is abnormal. And in seeing what is abnormal, systems zino eza kamera zirina ne osobola okuyisa gadgets endala n'oggyako akanyama n'okasindika wa pathologist akebere bw'oba olaba surfacing eri abnormal, osobola okufuna diagnosis. So ekyo kikolebwa endoscopy, kikolebwa waggulu eno, kamera n'etambula, ate tekitwala budde bungi nnyo, kikolebwa ne wansi eri ne kikka mu colon. So waliyo ne colonoscopy. Colonoscopy nti oli asobola okuba n'ebizibu nga biri mu kyenda ekinene, ne tuyisa kamera endala wansi eya colonoscopy, nayo n'etambula ebitundu byonna ebya ekyenda ekinene oluusi n'okwagala okuyingira ekyenda ekitono from down. Era in the same way we get to tell, because we know what is normal, we can tell what is abnormal. Okuyubuka infections ez'ekyenda, ebizimba mu kyenda, bikansa, n'ebintu ebinnyanya mu kyenda bye bayita diverticulum, n'ebintu ebyefaananiza ng'ebyo okubifuna ng'oyisizza zi camera. So endoscopy and colonoscopy is now a routine practice. It is part of us. And we really encourage people that have non-specific symptoms related to the gastrointestinal system to have these tests done.
Yeah.
Because it's the only way to tell in a gold standard way what could be wrong inside.
Yeah.
Yes. So it's a routine practice. So many facilities have it. We have it here as well. And I would encourage the general population to seek and benefit from this service. Because out there are so many people who are treating ulcers, in quotes.
Exactly.
With a few off-the-counter drugs. And yet what they have on the inside of the belly could be something else. They could have hernias on the inside. They could have tumors on the inside, cancers. So,
I'm part of it.
Yes.
Some years ago,
yes,
I had, I used to, at some point I could even faint.
Yes.
Nazirikako kemirundi ng'ebiri. Nazirusa mu ddwaliro naye nga hospitals, they say, kati tujjeko stool. Ne bagamba olina ulcers.
Yes.
Ne bakuwa eddagala beeriti. Kati oluusi ne bagamba tumuggyeko omusaayi kati tumuggyeko nnyo gondi. Omusaayi guyinza okuba more accurate. Again, nezikomawo ne bagamba nti olina ki? Na ulcers. Until I went and did an endoscopy.
Yes.
And what shocked me the most, omusawo okungamba, you don't have ulcers.
So yeah, it shocks.
But then he was telling me, chenali nina GAD. Ina very close symptoms.
Similar to ulcers. And the treatment at some point is almost the same. Only that GAD at always anganga, there is a lot of lifestyle changes you need to make, and stuff like that. Kati, very good. For you, you've already been in the drill. There are so many patients out there who are treating ulcers, and it's not ulcers. An ulcer is like the way you'd find a pothole in a road. There are actually very few people who, on endoscopy, have actual potholes in their system.
Yes.
Many people could have just a roughening of the surface or features of reflux of acid coming back into the esophagus where it does not belong, to give them chronic pain in the upper abdomen. So GAD is a very commonly occurring condition in the gastrointestinal system, like you discovered. And true, there are actually very few people who on endoscopic evidence have the real ulcers. Yeah. So it helps. If we could encourage the entire population, especially to draw awareness towards the availability of these services, and the fact that it would be very nice every time you have abdominal symptoms, they are not getting relieved with routine drugs, please seek an endoscopy or a colonoscopy. When people get to their 40s, it will be so nice that even 40th birthdays, as opposed to gifting them, a suitcase or something, you can give them a voucher for an endoscopy. It's a very good thing to do, so that some lesions, once discovered early, can be dealt with early, and somebody gets a lot better.
And I think for me, endoscopy, kyenagiyigako kyali kimu kyekiri kyoyogedde nti kintu kibi nnyo mu bulamu okuba ng'ojjanjaba ekintu nga tomanyi. Because then feno mu psychology, we know that just okubeera ku ddagala for so long is another cause of a lot of mental health problems, because you begin thinking the worst, you know.
Yes.
And today we have a lot of herbal solutions on the market.
Yes.
Naye nga zonna zigamba tujjanjaba ulcers.
Aha.
Naye nga kituufu basobola okuba bajjanjaba ulcers. Naye nga gwalinywedde ate tolina ki?
Njawulo.
Tolina ulcers.
Tolina na ulcers, yes.
So kati gwe n'obagamba nti tebakola. Naye kati ne nga bw'ogambye nti we need to raise awareness about the endoscopy. Even these guys who are selling herbal medicine now need to begin telling these people, first go do an endoscopy.
Yeah, it would be fair if that information is given out by all cadres on professional grounds that olumizibwa mu lubuto, wadde eddagala emirundi gijo, you have come back here so many times, you're not getting a relief of symptoms. Why don't we find out what is inside that intestine? And the best gold standard way is to put a camera there.
Yeah.
And that is what we normally, or your hospitals will tell you, is described as an endoscopy or a colonoscopy.
Yeah. But, and then maybe also as doctors, you need to sensitize people about the fear of the endoscopy. When I was going to do the endoscopy, every like the 4 people I told were like, ogenda kufa. But when I went there, bankuba bukuba eddagala ne neebakabe nti
yes. Nebakola. So endoscopy practice is being done safely here in Uganda, and that TMR will do it very safely. We have not had a single incident with any of the endoscopy or colonoscopy patients we've had. Whereas incidents can happen, we have not had any. And safety profiles in putting people to sleep have now been heightened. We have anesthetic officers, trained professional anesthesiologists, anesthesia providers that put people to sleep and monitor them. And to take away the discomfort of doing the endoscopy awake. Some people previously, those endoscopies would be done awake. But it's extremely uncomfortable and to some people extremely painful. And many of those studies have shown that no one would want to have that investigation awake. So the alternative, the gold standard way, put somebody to sleep safely and then put your camera, check, take pictures, take off biopsies or small tissues to represent an area that may not look very nice, send it to a pathologist to check and bring it back. This endoscopy practice is transforming into many things. Sometimes it can be used for cure. For example, you find small swellings there, like pimples that should not be there. They are extra gadgets. You can pass through the endoscope and be able to burn off or retrieve some of those swellings. In more advanced terms, can even be used to do corrective surgeries. People have different swallowing problems and food retention problems. And using endoscopy, some of these problems can be solved surgically, where you pass some gadgets on the inside and be able to do actual surgery.
So you do that here at TMR?
Yeah, so we do quite a bit of some other interventions that are not just diagnostic endoscopy. For example, putting of feeding tubes and taking out some of these other small swellings that should not be there. We do them. Though most of our spectrum are diagnostic endoscopy. Put a camera, find out what is going on. But in event that there is something extra, we need to do a small intervention, put a feeding tube, or remove a swelling that should not be there. These things we have the capability, we do them. Yes.
Isn't it very expensive doing an endoscopy?
No, the practice is now common. Endoscopies are getting cheaper. I think they are affordable depending on the practice you visit.
Yeah.
And here at TMR, they are routinely affordable and they are available on insurance packages as well. Yeah, so insurance, for those who have insurance packages, my experience has been that most insurances cover routine endoscopies and colonoscopies for diagnosis.
Wow.
Yeah, so it's becoming a more readily available practice and it's not very costly, the endoscopy.
So can someone just walk in and do the endoscopy?
Very good question. Because to do an endoscopy, the goal is to see. You want to see the walls of that intestine clearly. So it will be very important to prepare your patient. So it would be nice if I talk to the patient before and I know what kind of condition I suspect. If it is a condition like obstruction to flow of food contents, this is a patient that I may have to prepare for a longer period of time to get out the food content so that I'm able to see clearly the walls and to make a diagnosis. But if it is a routine diagnostic endoscopy, these are patients we tell to starve literally overnight. You have your dinner, walk in the morning, then the stomach is empty.
Yeah.
Excuse me. And we can have the what?
The endoscopy.
Yes, yes. If it is a colonoscopy, it's a little bit more tricky to prepare. Preparing patients for colonoscopy could start a little days before you tell them take fluid diet. Then the night before, they could take some medicines that help to evacuate stool, so that when you go there, you go through the colon, the large intestine, without finding stool, so that you can see clearly and have a proper diagnosis. Yes, so it takes a bit of preparation. It would be nice for the patient who is going to have this procedure to interface with their doctor, or at least a doctor before going through the procedure, so that they are well prepared for it.
So bagana afe abali eyo muno nga mukuluma nsawo nga bannyonnyodde muno ne wanaawaddako mpulira hatibaani buli kiseera ne mutandika okwekwasa. Buli wendya lumonde nfuna hatibaani. It is a sign. Body tesobola kubanga buli kiseera ekuwa hatibaani. Abana emize magnesium yenna eddagala linnemye. Oyinza okuba magnesium omumirira ku kintu kirala ekitali kyolowooza nti kyekikuluma. So bw'oba olina ebirwadde ebyo ebipasistinze, janku TMR wano olabe omusawo bwe kiba kyetaagisa okole endoscopy oba colonoscopy. Colonoscopy ntiisizaamu
tewetaaga
antu kyekayita eno wansi eno.
Jjukira obeera weebase towulira. Tukayisaayo towulira, tolumizibwa. Era abantu bonna turnaround time for endoscopy wano eringa 2 hours. Wojjira nocheckinga in netukola endoscopy, akadagala ke bakuwayo nozuukuka. Routine it is 2 hours oba ready to go home. Colonoscopy, because ebiseera ebisinga tubategekerako mu ddwaliro, is a little longer. Yes, naye bonna bafuluma bagenda. So tebiraliikirira ate towulira bulumi kuba oba totegera kigenda mu maaso.
I understand. So you get to know your system inside. Ne bakugamba nti namu genda olye onywe.
Abantu bangi bajjanjaba zi hemorrhoid, bagamba bleedinga wansi, nyina hemorrhoids obuzimba. Ne mwatunga ebiriyo ate birala. Ogenda okuteekayo kamera ate n'osanga nti ekiriyo si hemorrhoid, bizimba birala oba bitulituli birala. So zino test za mugaso nnyo. Olina okumanya ki ekiri munda. And there's no better way to tell than to put a camera on the inside there, either as an endoscopy or a colonoscopy. I encourage the general population to seek these services, especially those that have pain, chronic pain, and the symptoms: vomiting, diarrhea, bleeding, vomiting blood, abdominal distension, alesatayate okutamangu.
N'okukutamangu.
Yes, because the stomach is supposed to receive food in a special way, keep it for you, and you get satisfied after certain capacity is reached. So early satiety, maybe it blows up with gas and gives you a sensation of fullness early. So this group of symptoms has to be investigated by putting a camera on the inside, which is what we are describing as endoscopy and colonoscopy.
Now, don't you sometimes feel like ew?
No, this is what we do. So because it is what we do
well,
very well.
So you just
If
don't...
it was allowed, I would even eat in the endoscopy room. But it's okay. I eat food well. I am I've acclimatized to this kind of practice. So it's my work. So this is my routine work. Just like your work, it's my routine work to put cameras, and it's a system I'm working
in. So you go into someone's intestines and go, yeah, yorika.
It is okay.
You don't feel like...
No, nothing.
Kati byo ebyenda by'embuzi nte byo birya.
Byonna mbirya.
It doesn't feel like I saw this and...
It's very different. The way the mind is wired is different. When I'm wired in medical practice, surgical practice, endoscopy, colonoscopy, it's different from the way my mind is wired when I'm in a restaurant to eat my
ordering
food.
For
How
intestines. Akatogo k'ebyenda.
Yes.
Okay. But do you see people the same? For example, if you took a camera through me and what you see and you're like...
Yeah, we usually crack a joke and say, we are going to see your inner beauty.
So most of us are not beautiful inside.
We never come out to say you're less beautiful than the other one. We come out to divulge findings, actual scientific findings of what we found. But yes, different people to each their own body. Different people, for several reasons, will have different indications and different findings. And we respect all of them and point them to a solution, depending on what we find.
Okay. But then many kariko gami aka inner beauty.
Tetugamba you're less beautiful than.
Mwe tulaba ko TikTok nga doctor ataddeko. Kasuku sengo manyi. Teyandi badde gwe.
It does not work like that.
Ngomuntu wamulaba mundu obulako muga nti kama wange gwe toteesa. I have a good heart into okusinzira ku bye tumanyi munda. Please don't say.
No. To each their own body.
I know. Kari, thank you very much for your time.
Thank you very much. It's been a pleasure having this chat with you.
Yeah, you're welcome. And yeah, you guys can always come around here. TMR Golden Living Specialized Clinic.
Yes.
You come, you have these conversations. Abasawo bano tubaleta chota tegedde what you need to go, because now this is just the surface.
Yes.
Yeah, sometimes you just need to come here, ask a few questions here and there, and yeah, you go deeper. And maybe even the treatment you want.
Yes.
So I've met so many people. Abangamba Kasuku, alusaze nnumi n'omu agenda okola endoscopy.
And now the awareness is a lot more. So we have more people coming for these endoscopy and colonoscopy services.
That's good.
Here and everywhere else. So it's good to see. It's good to see that people are no longer being treated blindly.
I know. So before you take that habo, so koje okola endoscopy otegeere kiki ekikuluma munda, oba colonoscopy ki ekikuluma wansi. Si kyekyo?
Yes, sir.
Kale, until next time, mbeere bulungi.
Mweraba.
The views expressed on Kasuku Live do not reflect those of the host, producers, or management. They are solely of individuals providing them and do not represent or reflect the official policy or position of this YouTube channel.
Luzungu kate Kasuku tujikole sawa namba Luzungu.
Luzungu tugenda mu kujjira kutoka ntoku ndimbuzi nyenkuno
ababura babaddi abakyala
wale somuyomba inyembuto katonda ya chembuto genda wedi waminge
yabaweereza buno bukeeke obutini
singa babu mutwale bamusonseka mu kamwa bwonna n'abufulumiza mu nnyindo.
Kibwa alina guno omuggo gwa Musa wayitista premium detergent.
waliwo banagambye emunda y'akasajja kasendi kalimba bannange